Dr. Hirennappa B Udnur, pulmonologist practicing at Sakar Nagar, Bangalore, Inspire Specialty Clinic. And I'm practicing at Columbia, Hebal and Bangalore Baptist Hospital. I've been practicing from 12 years now, and especially asthma is our bread and butter. And on occasion of World Asthma Day, I would like to tell one thing, that asthma definitely has a good control. I'm pretty sure that the treatment for asthma works much better and can do wonders in patient's life. I know the word, there is no cure for asthma, but it doesn't mean we need to get disheartened. The treatment like diabetes and hypertension, asthma has better treatments, especially now with the newer age, with the newer devices and the way the drugs are delivered into the lung. Only the taboo of not using the asthma through inhalers, that myth has to go among the general public, because the dose what we use in an inhaler is absolutely low dose and it should not cause much side effects. Side effects like oral candidiasis and growth stunting will not happen, especially if they are used in pediatric age group, and it can be used a pretty long time without addict forming activities. So the lowest dose of inhaled steroid with a long-acting bronchodilator is the treatment of choice, and that's the thing we look at. And when you look at asthma, all asthmatics may not have to take treatment as a lifelong, because some are seasonal asthmatic. You need only 3 months in a year, but many they require it lifelong. The lowest dose of inhalers to keep the asthma under control. What do you mean by control? When you treat asthma, like diabetic and asthma, we are looking at a control, and there are specific goals for asthma. The specific goal is they should be able to do their routine activities without having any breathing difficulty, and they should be able to sleep well in the night and not get up because of wheeze, and they should use a minimal dose of short-acting inhalers like Asthma very less frequently if they are on regular treatment, and they should not get hospitalized for exacerbations, and emergency visits should not be required. And by taking inhalers regularly, which are long-acting now we are just going on to once a daily preparations, and the devices which are more breath-actuated devices are coming, and if they take it regularly, you may not require as and when required Asthma requirement, and they can lead a life as normal as everyone. So asthmatic is not a hindrance for any kind of achievements, sports person, any hindrance for educational activities. Asthma should not be any problem. So like any other chronic diseases, I would like to reassure in my 12 years of practice, where I have detected the patients, usual physician diagnosis, or sometimes a very minimal tools like PFT and peak flow meters are enough. By ruling out alternative diagnosis like X-ray and cardiac, sometimes you can have a good control of asthma. I wish that if you are able to achieve at least 20 to 30% of the population, detect them early instead of suffering and taking the wrong treatment and dependent on oral steroids and abusing the oral steroid, inhalers can make a difference in one's life. Thank you very much.